Hi everyone, my name is Angelo Wijaya and I'm a member of UNFPA Indonesia Youth Advisory Panel for 2019 to 2021. In this second episode, I will be sharing to you and I will be answering some of the burning questions on everyone's mind. Are young people affected by this COVID pandemic? And what can I do as a young person to protect myself and others? All of the information that I'll share today is based on recommendations from the World Health Organization. And to stay informed, please visit the WHO website and follow the latest update from local government and local authorities. I also want to note that some of the information that I share today might change as the outbreak is evolving quickly. So, first off, are young people impacted by COVID 19? COVID 19 hits certain groups hardest, especially older people and those with underlying medical conditions. But be aware that young people are not invincible. Younger people are not immune or safe from the disease. Even death rates for young people are lower. Some of you, around 3% of young people, might get very ill and require hospitalization. In fact, a significant proportion of hospitalized patients globally are under the age of 50. So, next, how is the COVID 19 outbreak impacting us? All of us are being impacted by COVID 19 in different ways. For example, in Indonesia, in my country, schools are being closed down, offices are being closed down, and the government is taking massive social distancing measures to curb the impact of this pandemic. Many of us might have lost jobs or income. For some of us, home is not always a safe place to spend time, and by spending more time there can increase the risk of violence and abuse. Some research also shows that pandemics make existing inequalities worse, especially gender equality. This means women and girls are disproportionately impacted uh, by this measure and may also be at risk of abuse. How about our family? All of our families, relatives, and loved ones are feeling the impact of COVID 19 in different ways too. They may have lost their jobs, may have reduced work opportunities, or are feeling uncertain about their future. They might also have increased responsibilities at home, such as providing for their families and taking care of their children and elders. So, in the face of all this, we must remember that it is 100% for us. It is 100% okay for us not to be okay right now. It is important to understand that everyone will react differently to what is happening right now. Confinement, isolation, and quarantine measures impact everyone, and many of us feel helpless sometimes, anxious, lonely, or simply extremely bored. So, in light of all this, what can we do? Small actions can make a big difference. And how to do that? Do not panic, but stay informed by checking the WHO website and take the proper precautions. Second of all, take care of yourself, your family, and your community. This is the time to stand in solidarity with others, especially with health workers and those at greater risk of getting seriously ill. For your health and well being, the most important thing you can do is to protect yourself from infection. If you're unsure how, watch the first videos in our series. As much as you can, try to stay healthy. Eat well, make sure you're sleeping enough, and exercise regularly. Take your regular medication and seek healthcare if needed. Your mental health is just as important as your physical health. Here are some ways we can stay healthy at home. First of all, pay attention to your own needs and feelings. You're not alone. Reach out to someone you trust to share how you feel. If you're feeling distressed, you can limit your daily news intake and take breaks from social media. Physical distancing does not mean that you can't stay connected. Keep up your daily routines and try to do things you enjoy to reduce stress. For more tips, tune into our upcoming episode on mental health. For your family, share what you learn about prevention with your friends and family, and be careful around those who may be at risk. Be a role model in your family and community, especially to those younger than you. Make sure to check in with your family members and ask them if there's anything you can do for them. For your community, your actions can have a positive impact on those around you. Stay informed using reliable sources and fight misinformation or fake news that you might hear. You can look for opportunities to volunteer. Make sure you're taking the right precautions to stay safe. Fight stigma and discrimination. COVID-19 is a pandemic that affects all of us, regardless of geography, ethnic background, age, and gender. Everyone is at risk. Show your support for all essential workers who are putting themselves at risk, like healthcare workers, caretakers, food service clerks, and more. Tune into our next video to hear from youth leaders who are taking action in their community. Now that you know more about how young people can be impacted by COVID-19 pandemic, and even more importantly, how you can take steps to protect yourself and others, use this template to create your own video and share it with your friends. If you learned something new today, please join me in recording your own video and sharing it with your friends.